Thank you so much for the invitation here, and thank you for having me this afternoon after lunch. So this is something completely different. I'm not going to mention diabetes or endocrinology at all in my session. Hopefully you'll still find it interesting. And I do apologise because my journal is largely a clinical or at least health journal. So for the basic scientists out there, some of this might not be completely applicable to you, but hopefully you'll still take away something about publishing and when we're given a paper to assess. And this is to really help you to kind of tailor how you write your papers and how you choose the journals to submit to when you're thinking about your disseminating your work. So I'll just give a very, very quick, brief overview of my journal, and then I'll go into some of that. And I'm only hopefully going to speak for about 10 minutes because I'd like to be able to have some time for questions. We haven't got a panel session, so I'll leave some time. So please get some questions ready for me. I completely welcome that. So this is the journal. We were launched 11 years ago, or nearly 12 years ago now, and we were the first open access journal that the Lancet group published. So we do that monthly, online only. Gold open access means it's free to access all the time, so anybody can read the journal from the time it's actually published. We're getting more than 2,000 submissions per year now. And we're only publishing 14 of those per month. So that gives you an idea of this is what means by sort of high impact, because we're narrowing down the number that we actually accept. We're only choosing the ones we believe will be the most impactful. And our impact factor, which is a measure of, some measure of impact, but an imperfect one, as we can maybe discuss later, is 19 currently. And we now have 5 editors based in Beijing, London, and Rio. There's also a Lancet office in Chennai. My colleague Apoorv is joining me later this afternoon, so that's very exciting. I'll be meeting him for the first time in person. So what are we looking for in a manuscript? So there are sort of various levels of triage, I guess, that we go through when we're looking at a paper. And the first one, I guess, is a really an obvious one. Does it match the aims and scope of the journal? So, it doesn't matter how elegant your mouse paper is or how beautiful your immunofluorescence slides are. A journal like Lancet Global Health isn't going to publish it because it's not within the scope of the journal. So our journal looks at basically any health condition, but the focus is on disadvantaged populations. So we look at the population as being a whole economic region, so it could be a low and middle income country, for example, or it could be a marginalized group within an otherwise prosperous nation. So we might choose to publish a study of indigenous people, perhaps in Australia, which is a prosperous country, but indigenous people have a disadvantaged health status within that country. So that's the kind of thing we would consider, but really any health aspect. So we would obviously publish studies on diabetes and endocrinology as long as they were within a certain population group. So a high impact journal editor is really looking at this thing of novelty. And we can kind of argue about what is novel, because maybe we're thinking about novelty. Is it a brand new drug? Is it a completely new kind of disease process we're talking about? It's not really. All we're looking for is something that adds to what's already known. So it doesn't have to be a completely untested drug or intervention. It just could be something that's been done in one population before and is now being done in a different one. So it could be a study done in children that hasn't been done before, it's only been done in adults, or a high-income country versus a low-income country, or a urban area versus a rural area. It could be just an update, so it could be a really, really fast-moving field, so what's novel is what's happened in the interim period between when the last such kind of review paper was published. It could be a new type of method for doing the research in the first place. Or it could be a sort of a new prediction about the future, so a modelling study or something like that. So just something that adds to what has gone before. And we try and help authors to sort of spell that out to us by asking them to produce this section called Research in Context. So we're asking authors to actually summarise the evidence that's already out there. So what has already gone before, and how did you find that evidence? Why did you go about doing the study in the first place? What gap were you trying to fill in knowledge? And then we ask you to describe how your work adds to what's already gone before, and then sort of summarize what all of that together means for future practice or policy. Then obviously, once you pass that kind of hurdle, we're then looking for a sort of sound methodology. So if you're coming up with some novel conclusions, we want to make sure that you've based those conclusions on a sound methodology. So we're looking at things like the study type. So obviously, systematic review is quite a strong methodology, followed by a randomized trial, observational studies, case reports, etc. Now we will consider any of these types of study. But I guess we would be, as a high impact journal, looking at the more the top end of that kind of hierarchy of research papers. We do also look at qualitative research. I think this is becoming more and more important, especially in the field of global health, where a lot of what we are looking at are interventions that are known to work in high income populations, but we don't know why they don't work in lower income populations. And so qualitative research or implementation research can actually help us to tease that sort of thing out. So if you're doing a randomized trial, we'll be also looking to see whether you pre-registered the trial. Most medical journals now won't consider randomized trials that haven't been pre-registered in a publicly available database. We'll be having a look at the sample size. So if it's a very, very small study, maybe the findings are just hypothesis generating rather than being a little bit more concrete. That would be for a lower impact journal. We'll be looking to see whether you control for confounding, done any sensitivity analyses, and whether if you've used a study instrument like a survey or a questionnaire, whether that's been validated in the population of interest. And then we might be having a look at the generalizability of results. So for a global journal like Lancet Global Health, which has an international readership, if you've done a study in a one hospital in one country, relatively small number of patients, the generalizability might be quite low. So you might be better off sending that to a journal with a more regional focus or a more specialty focus. So here's this potential for impact. And what do we mean by impact as editors? And I guess it's really the so what factor. What we want to know, why did you do this study? What was the point of it? And has the research actually answered the question you set out to answer? Or is your overall conclusion that more research is needed? If your conclusion is that more research is needed, again, perhaps that wouldn't be for a higher impact journal. Perfectly good to reproduce what's gone before, important, but not for a higher impact journal. So, and then finally, what do the findings mean for practice, policy, or future research? So again, it's important, even if you know as a researcher why it's important for practice, policy, or future research, it's really important actually to spell that out in the paper, not only to the editor who's going to do the first level of triage, but also the peer reviewers, and then ultimately the readers who want to know why it's important. So for us, what makes a good global health study? So again, it's something that attempts to fill a gap in knowledge. It might be something that puts the issue into a wider context. Something that demonstrates contextual feasibility or sustainability. So we see a lot of studies, or we have seen in the past, largely driven by researchers in the global north, but perhaps the study was done in a country in the global south. And so the contextual feasibility or sustainability is sometimes a little bit in doubt, because there can be a potential for researchers from the higher income countries to sort of parachute in, do the work, go out again, and then leave a bit of a mess on the ground with nothing going forward for the population that was actually being studied. We'd like an indication that it could be replicated elsewhere. So even if it is not particularly generalizable, but that if you can give us an idea that it might be replicated elsewhere, that would be useful for us to know. We're increasingly asking for studies to be disaggregated by sex, gender, race, and ethnicity where possible, because this again is becoming an increasingly important element of teasing out why certain things work and certain things don't work, because we haven't looked at the population in a granular enough level before. So teasing out by these important elements is something that we're looking for increasingly. And then again, this sort of element of involving in-country researchers from the planning stage is becoming more and more important for us. So I said a lot of work is that we receive has been done as a collaboration between researchers in high-income countries and low-income countries, usually done in the lower-income country. So we want to know whether the researchers as well as the patients, how were they involved in the process? Were they treated as equal partners? Were they driving the research question because they have the contextual knowledge of the region? And so there are other sort of questions and considerations that we are now considering around that kind of thing. So I've mentioned this parachute research. So if we see a paper now that's actually done in a lower middle income country, but there aren't any authors from that country on the paper, then we won't take the paper any further forward, because we believe that's not an equitable way to do collaborative research with North-South partnerships. And sort of on the corollary side of that, we're now asking peer reviewers from countries where the study was done to actually review papers as well, because again, you need the contextual knowledge to understand whether the findings have been interpreted correctly and whether actually there is any element of feasibility and sustainability of whatever intervention is being studied in the paper. We're encouraging authors to submit translations of the article abstract into any language that they choose that could be relevant to the audience that is intended to be the target. So the authors have to do the translation themselves, because again, we assume they have the knowledge to do that, and we can support the publication of it at the end of the peer review process. We understand that lots of people are submitting papers in a language that isn't their first language. So we are saying, you know, as we used to say, if your English isn't perfect and you submit the paper to us, that's fine. It's not going to be a barrier to publication. Now we have this wonderful thing called AI, which can help us to polish our papers. So we're saying that's fine if you're using AI just to make sure that language is good and understandable, and you know, relevant to the sort of audience you're writing to, that's fine. So we ask you to declare it, but it's not you know, a barrier to a publication with us. And we're now asking authors to document how those North-South partnerships were made equitable, by asking, again, authors to prepare a statement that shows how the involvement of researchers based in the region were actually involved in the study design, as clinical processes, any data interpretation, and the manuscript preparation. We're also asking how any funding was used to remunerate and enhance the skills of researchers and institutions in the areas of study, and if there was any use of the funds to improve research infrastructure. We ask about safe working conditions. How was that determined for the researchers on the ground? And how were local priorities determined and used to inform the research question? Who decided which priorities to take forward? And then we're asking, how will these research products be shared in the community of study? So again, it's important, if you're involving people, particularly people in lower middle income countries, how are they going to find out what happened to their involvement? How are you going to take the study forward? So that's the end of my presentation. I went just over 10 minutes, but I really welcome any questions. I know it's a very short session, but I will be here afterwards also as well, in the tea area, I guess, if anybody would like to come and talk to me about it. But if anyone has any burning questions now, please go ahead. Dr. Powers.
Al Powers from Vanderbilt University. That was very helpful. It's really great to hear how you think about that. I think it's relevant to no matter what kind of journal you're doing. So where is the publishing field going? Yours is a virtual online journal only. Is there more value for ones that are actually printed? It sort of seems that way. It's sort of that, but it doesn't make sense. So are journals going to go away, much like newspapers and things like that, because the distribution of those is so limited? And then if you could address how equitable access to your journal is, because do you have to subscribe? Do you have to be part of a library that subscribes? So how are you ensuring as a journal that your publications have access to the general public? Thank you.
Thank you. Yeah, it's a great question. So I mean, both parts of that question are linked. So, of course, if you're printing a journal, you have to subscribe to it. You have to pay to subscribe to it because we need to know where to post the journal, and we need, printing a journal costs money. So, so that subscription model, I think, is moving away. I mean, people do want a physical copy still, I think, but that is inequitable because not everyone can afford to pay for that to be distributed to them. So our journal is an open access journal, which means that it is available online to anyone. So nobody needs to subscribe to it. Anybody here can access any of the articles at any time. So the open access model means instead of paying to read it, you pay to publish in it. So again, we have a price to publish, but only if your paper gets accepted. So you don't pay to submit to the journal, but if your paper is accepted, you do pay a fee at that point because nothing comes for free, right? So if you value journals, which is debatable, which is a whole other presentation, then we have the price has to come somewhere. But then to make it equitable for researchers submitting, we do have a sort of sliding scale depending on where you are in the world of what that price is. So for India, for example, there is a 60% discount on the general publication cost. So that's how we try and make it equitable. Thank you.
Hi Zoe, very interesting presentation. I'm Vandana from Delhi. So my questions are, one is regarding this open access only. So I think most of the high impact journals are becoming difficult to publish because of the cost involved for many people in India, because India doesn't come in the low income country, it comes in LMIC, and so even paying that much becomes difficult because it has to go out of your project or out of your own pocket, and so that is one concern. So how can we address that? And the second concern was about the peer review process. So like how many reviewers should be the bare minimum for reviewing a paper? Like how many do you use? Because sometimes there are just 2 reviewers, and even if one recommends rejection, then the paper is rejected. So I feel that peer review process also, and sometimes there may be a bias because it's not totally, even if it is anonymized, there may be an element that people recognize you, and if the reviewer doesn't like you for any reason, so that may be a reason to reject. I mean, so how do you address these issues?
Yeah, thank you. Yeah, we understand that it is still a high cost for people, even at a discounted rate. And so the one thing I would just say is that we've never not published something because the researchers were unable to pay. So if you think you don't have the funds, and we do kind of assume that it's built into the project cost. So a lot of funders will expect you to write into your grant a publication cost. We're definitely not expecting it to come out of pocket ever. That would be totally wrong. So I would just say always approach the editor and say we have no more funds, and any ethical publisher, I think, should say, well, that's you've done what you can, we'll still continue to publish it. So that's the best we can do, I think. In terms of peer reviewers, we ask for 4, minimum of 4. One of them will be a statistical reviewer. Then we try to get a mix of sort of subject specialists, population specialists, so somebody from the region, and then a method specialist, probably someone a bit more familiar with the method, or sort of some kind of mix. So they'll all be quite different reviewers, and their reviews will be kind of assessing different parts of the manuscript. But yeah, we personally, I don't see problems with people being biased against individuals. I think hopefully those days are gone. But certainly, if you get more than 2 reviewers, that can at least help to mask any ones that are particularly biased.